Hey everyone, I'm DJ Williams here at MD Hair Labs with Dr. Clifton. This sweet angel that I've told y'all about before has been sent down from above to answer the prayer of please help me grow my hair back. I know a lot of people at home are experiencing baldness, and it is what it is. It's a very sensitive subject, but we're here to talk about it. I've been with you and you've given me hope for the future.
And, you're looking great.
Yeah, I know, right? But the thing is, you have to stay on top of it. That's the way that this works. And so I want to talk about a treatment you call Keralase. Am I saying that? Keralase?
Keralase.
Keralase. I know I was going to get it right. Keralase. Yeah.
All good.
They got fancy stuff here at MD Hair Labs. But tell me about this treatment.
So Keralase is a really cool treatment. It's two kind of steps. The first step is something called the Lutronic Ultra, which does sound really fancy. And it's a laser device that we truly just run through the scalp. And it makes these little tiny microchannels. It's virtually painless. It feels like a little tingle.
Wow.
But it doesn't require any numbing. We've never had anybody say, oh my gosh, I can't tolerate that. It's just really, really very simple. So we run that through the scalp in the areas of hair loss that we're trying to treat. And then we apply a topical solution called KeraFactor. And KeraFactor has some really very powerful growth factors within it and a couple of bioidentical proteins that really stimulate the scalp to have really good scalp health, increase the vasculature, the blood flow to the scalp, which stimulates hair growth and hair health.
You talk about stimulating that hair growth with a lot of things that you offer here. What is it exactly at home that you can tell the people that is causing their hair loss?
So there can be many, many different types of hair loss. The most common hair loss we see, especially in men, is pattern hair loss. We can see that in women as well. There's also hair loss that's happening like post-trauma or post-illness, which is called telogen effluvium. That happens after COVID. I know, fancy words. I just threw that out there. It happens after COVID a lot of times, so this would be a great treatment for people that are experiencing that. Some other types of hair loss are more autoimmune, and so you might need to address those in other ways, but this would certainly be a supplement that you could add in addition to medical treatment.
Yeah, and speaking of medical treatment, one thing that a lot of people like to be aware of before they get into it, some people are allergic. Is this treatment for me? Are there some serious side effects that could be different for me than someone else? What is that whole aspect like?
Well, that's the really cool thing about this treatment is that the only potential side effect would be if you were allergic to any of the compounds that are in the KeraFactor to stabilize those proteins and growth factors. That would be extremely rare. We've done so many treatments and we've not had any of those issues or side effects, but that would be really the only possible side effect from it.
This one doesn't seem like you'll have too much downtime. I know after I did my hair procedure, a few days after, some of the swelling started coming down. I was like, oh, I called you. I was like, well, you said don't worry, it's part of it.
It's part of the deal.
What about this?
So this is completely non-invasive.
Oh, wow.
So it's awesome. There's no needles, there's no numbing, there should be no swelling whatsoever. Even though it is a little device that's making microchannels in the scalp, they're so tiny you can't even see them. So it's not like anything visible. The only negative to it is you do put the KeraFactor on, which is a liquid, and so your hair's wet, when you leave.
Okay.
And you can't wash your hair for 24 hours.
Okay.
That's the worst part of the whole thing.
Now, we talked about multiple different treatments here, and one thing you kind of touched about, some of the really high-end ones for people at home who sometimes are on a budget.
Correct.
Would this be a good option for them?
This is extremely affordable. Awesome. It's a lot less pricey than some of the other options like EV Pure and Vidi Pure, certainly a lot less expensive than a hair transplant. So yeah, it's a very, very good option for people. Especially people who hate needles, because there's no needles whatsoever, and really no downtime. So this procedure, super affordable, super good for anyone. You do have to come in to see us a little bit more often with it. It requires a treatment every 2 weeks. You need to do 6 treatments total.
Okay, sounds good. All right, everybody, we got so many options out there for everyone, and like I said, this is nothing to be ashamed about. Come in, get a consultation. They're going to make sure they're not going to waste your money, see if you're a good candidate, but from what I've heard, everyone out there has hope.
Absolutely, and we really do have an option for really anyone with any budget or any set of concerns. Right. So come see us.
Y'all come see her at MD Hair Labs. I promise you, she's going to take care of you. All right, set your appointment today, right now. Not now, but right now.